You must consult the user manual for the full contraindication list before treatment. This video does not replace training led by an authorized specialist. Always read the user manual before using the Emsculpt device. Position the device near the treatment bed as demonstrated. Do not place the device in direct sunlight or near heat sources, as it may lead to an excessive temperature increase for the device. Also, do not cover the device or the applicators during the treatment. Ask the patient to remove all jewelry and any metallic accessories, including piercing, before treatment. The patient should also avoid wearing any clothing with metallic parts, such as zippers, bra wires, etc. Do not place any metallic item, as well as any electronic devices, cell phones, data carriers, credit cards, etc., close to the applicator. Consult the user manual for complete information about treatment precautions. Place the fixation belt on the bed. The patient should remove clothing from the treatment area. Have the patient lay down flat on their back. You may want to place a bolster below the knees to relax the abdominal muscles and lumbar spine. Secure the applicator in the treated area with the help of a fixation belt supplied with the device. Make sure that the applicator is adequately secured to avoid any applicator movement during the treatment. Do not treat directly over bony areas. Make sure to keep the applicator positioned symmetrically over the treated area. For bigger patients, use 2 applicators at the same time to ensure complete coverage of the treatment area. Select desired protocol and applicator channel. Start the therapy. Increase the power intensity until reaching visible contractions. Correct the applicator's position to find the best muscle response. The patient should feel contractions homogeneously across the treated area. To ensure therapy efficacy, increase the intensity up to the patient's tolerance level. For an effective treatment, keep the treatment intensity at the level which causes the strongest possible muscle contractions. Emsculpt treatment may feel very intensive, but should never be painful. A strong muscle response is essential to maximizing treatment results. However, patient comfort should never be compromised. Make sure that you maintain the treatment settings just below the patient's maximal tolerance threshold. It is important to maintain verbal contact with the patient during the treatment. Ask them how they feel, adjusting intensity accordingly. The patient should feel intense but tolerable contractions without any pain. Keep checking for comfort level and contraction intensity regularly. The treatments may require multiple applicator adjustments. Make sure that the applicator stays centered over the treatment area for the entire time. It is essential to make adjustments during the treatment if necessary to maximize the efficacy. Continue to increase the intensity during treatment if tolerated well by the patient. Lower the intensity temporarily if the patient reports discomfort. There should be no pain. Try to increase the power back to original levels if the patient can later tolerate a higher intensity. Remove the applicator when therapy is completed. The patient may feel mild muscle fatigue after the treatment. The device will automatically cool down both the system and applicators after the completion of the treatment. Never unplug the device during the cool-down process. The applicator is not secured by the fixation belt. The fixation belt is not tight enough. The fixation belt is placed incorrectly. Always use a treatment intensity just below the patient's tolerance threshold to ensure the strongest muscle contractions. The applicator must never be covered. This may compromise the cooling process. The applicator is positioned incorrectly. The applicators must never overlap each other. The applicators are positioned incorrectly. Do not start the treatments while the applicators are still in the holders. If the pulse quality monitor stops your treatments, make sure the applicators are positioned correctly.